Regenerative medicine has gained increased attention as clinicians and researchers search for better ways to address chronic disease and age-related decline. Within this evolving field, progress often depends less on single treatments and more on the systems that support safe research, clinical oversight, and long-term patient monitoring. This framework-driven view has shaped the professional work of William Basta, whose focus centers on building healthcare models that prioritize structure, accountability, and measurable outcomes rather than short-term gains. With a background in health services, technology-enabled care, and healthcare advisory for early-stage companies, he has brought together his work experience under the idea that improving people's lives requires the use of a coordinated system of diagnostic, clinical judgment, and patient engagement, all of which must be in place over time for effective treatment and recovery. With this understanding, he has begun a series of new partnerships with stem cell and regenerative medicine researchers and health practitioners, who share his goal of advancing responsible collaboration in the field. Stem cell research and related regenerative therapies hold potential for tissue repair and functional recovery in areas where traditional interventions may fall short. Yet the field also faces scrutiny from regulators, physicians, and patients due to inconsistent standards and unverified claims in the marketplace. Addressing these concerns requires partnerships grounded in evidence-based medicine and ethical clinical practice. Within regenerative health initiatives connected to Basta's work, emphasis is placed on licensed providers, validated laboratory partners, and protocols that align with established medical oversight. These collaborations reflect a commitment to cautious progress rather than rapid commercialization. By working with clinicians experienced in regenerative applications, these efforts aim to ensure that new therapies are introduced with appropriate patient screening, follow-up, and outcome tracking. Instead of seeing regenerative medicine as a single answer to all problems, this method considers regenerative medicine to be part of a larger plan of care. Regenerative medicine is not looked at in isolation but as part of an approach that includes advanced analyses, use of complex scientific instruments to measure very small quantities of cells, the long-term accumulation of data about patients, and reliance on physician-directed decision-making. The foundation for this partnership-driven model can be traced to Basta's work in precision health and telemedicine. His ventures emphasize early detection and continuous monitoring through advanced diagnostics and remote access to care. Rather than episodic treatment, these systems focus on maintaining patient engagement across years, not weeks. Within this framework, regenerative therapies are evaluated alongside lifestyle data, biomarker trends, and clinical assessments. Such integration allows providers to determine whether regenerative interventions complement a patient's overall health strategy or introduce unnecessary risk. The goal is not to replace conventional medicine, but to extend it through carefully governed applications. This systems-oriented design reflects a broader critique of fragmented healthcare delivery. Disconnected labs, specialists, and digital tools often lead to incomplete decision-making. By contrast, integrated platforms seek to unify these elements so that emerging treatments like stem cell-based therapies can be assessed within full clinical context. Partnerships with stem cell innovators emerge through shared standards rather than transactional arrangements. According to Basta's advisory philosophy, collaboration begins with alignment on patient safety, regulatory compliance, and transparent data use. This alignment allows clinical teams and researchers to test regenerative approaches within clearly defined boundaries. In practice, this means working with laboratories that adhere to recognized quality controls and clinicians who understand both the potential and limitations of regenerative methods. These partnerships often include shared protocols for data collection and patient follow-up, ensuring that outcomes inform future care decisions. Such collaboration supports gradual knowledge building within regenerative medicine. Rather than positioning stem cell therapy as a universal solution, these efforts treat it as one evolving tool within a complex clinical landscape. This measured stance reinforces credibility in a field where public trust remains uneven. Regenerative medicine is supported through the use of telehealth to help with both access and continuity to care. In addition to offering patients the ability to consult with specialists remotely from anywhere in the world, telehealth providers can use digital monitoring devices to keep track of how patients are recovering and responding to their treatments over time. Within Basta's health initiatives, telemedicine is not viewed as a substitute for in-person care but as an extension of it. Patients undergoing regenerative protocols can maintain regular contact with providers, report symptoms, and adjust care plans based on real-time data. This continuity reduces gaps that often undermine treatment effectiveness. The integration of telemedicine also supports ethical scalability. By standardizing workflows and documentation, regenerative programs can expand responsibly without compromising oversight. This structure is particularly important as interest in regenerative therapies grows beyond major urban centers. A recurring theme across Basta's work is the emphasis on long-term value rather than immediate results. In regenerative medicine, this translates into careful patient selection and realistic outcome expectations. Partnerships with stem cell innovators are evaluated not only on technical capability but also on ethical alignment. This ethical focus extends to patient education. Clear communication about risks, benefits, and uncertainties is treated as a core responsibility. By avoiding exaggerated claims, these programs aim to foster informed consent and sustain trust between patients and providers. Long-term outcome tracking further reinforces accountability. Data collected over time helps clinicians refine protocols and identify which patient profiles benefit most from regenerative approaches. This evidence-driven refinement strengthens the legitimacy of the field and supports responsible advancement. Beyond direct clinical initiatives, Basta's advisory role influences how regenerative health companies structure their operations. Guidance often centers on governance frameworks, compliance readiness, and data integrity. These elements are critical as regenerative medicine intersects with regulatory scrutiny and payer considerations. By helping organizations design durable operating systems, advisory work contributes indirectly to higher standards across the field. Companies that prioritize structure and transparency are better positioned to collaborate with academic researchers and established medical institutions. This alignment enhances credibility and supports broader acceptance of regenerative methods within mainstream healthcare. The development of regenerative medicine does not exist in isolation. To make progress in this territory, regenerative medicine will need to coordinate with aspects of diagnostics, preventive care, and chronic disease management. By taking a systems-based approach, Basta places regenerative therapies within a wider ecosystem of health science. Advanced testing identifies candidates who may benefit from regenerative interventions, while longitudinal monitoring assesses durability of outcomes. This integration reflects an understanding that regeneration and longevity share common foundations in metabolic health, inflammation control, and lifestyle factors. By embedding regenerative care within comprehensive health systems, these partnerships avoid the pitfalls of fragmented delivery. The result is a model that aligns experimental therapies with established clinical pathways. It is important to find a balance between being open to new approaches to the development of regenerative medicine while also respecting existing data when developing partnerships with stem cell innovators. When creating these partnerships, it is crucial to have an equal focus on preventing either stagnant innovation or immediate adoption of inferior products and procedures. Within Basta's initiatives, restraint is treated as a strength rather than a limitation. By progressing deliberately, these collaborations aim to build a foundation that supports sustainable growth and professional acceptance. This measured pace contrasts with more aggressive commercialization strategies that have drawn criticism in the past. Such balance also protects patients, whose trust is essential for long-term success in regenerative health. When programs demonstrate commitment to safety and transparency, they contribute to a more stable environment for future research and application. The collaboration of regenerative health experts is indicative of a larger initiative to stabilize the field of regenerative medicine by providing a framework for accountability and structure. The goal of these collaborative efforts is to advance the field through integration of stem cell research within the entire continuum of care for patients while maintaining ethical standards and scientific integrity throughout clinical and non-clinical research. This approach validates a core principle of contemporary medical science, namely that significant advances require the existence of systems that allow for ongoing support of the evidence and medical governance, as well as access to patient-centered care. As the field of regenerative medicine continues to grow and develop, future partnerships may play an essential role in determining how these new therapies will be developed, tested, and introduced into conventional healthcare delivery.